state's facing a $3.3 billion budget deficit. So there's not enough money for everything that the state wants or needs. Legislators have made clear that one of their priorities is funding the response to the pandemic. Yet mental health resources could be cut. Our Nusha Roy had some questions about that.
There is both empathy.
I really sympathize with the folks with the Joint Budget Committee.
And strategy.
Whatever can be defended for the sake of the health of the population.
The state's Joint Budget Committee is dealing with a more than $3 billion shortfall for the fiscal year that starts in July. On the list of debated cuts, $1.6 million from jail-based behavioral health services, reducing money to raise awareness for resources like the Colorado Crisis Services that saw a record-breaking number of people reaching out for help in February, March, and April, and cutting back on funding already promised to help low-income individuals access help.
We know that there are people who are in even more vulnerable positions.
Part of the response to COVID-19 includes addressing mental health. Funding the pandemic response is still a budget priority.
That's the toughest part of where we're at right now.
So we asked the Democratic House Majority Leader why mental health resources are facing cuts.
It's not really how can we add to the programs to help them, it's how can we limit the reductions.
That also means looking elsewhere for alternatives.
Are there ways that we can partner with the federal government?
At the end of the day, so many resources are going towards one health crisis that's had such a massive economic impact, there isn't enough money for all the other needs.
The state had been making good progress. That progress is sort of being brought to a standstill. That doesn't make the vulnerability or the needs of those folks go away.
So, of course, the Colorado Crisis Services is available 24/7, and everything we were talking about could also be potentially impacting help when it comes to substance abuse. Now, in total, there are 370 proposed bills that are still in the pipeline, and Kyle, we were told today that a lot of those are most likely going to be postponed.
You know, Nusha, one thing that we talk about every legislative session is that the cheaper your idea is, the better chance of it passing. I imagine that really applies now.
Oh, absolutely. I mean, Mental Health Colorado said their only hopes at this point that they think could even be passed if it's fast and if it's free. So an example of that could be improving educator training for mental health, which would be something that the educator might have to pay out of pocket. So that's a possibility.
All right. Nusha Roy reporting as always from the Brick House. Thank you, Nusha.